Good evening, everyone, and welcome to OET Listening Prowess. This is me, Shaji, joining you from Nidus Academy. Yes, Nidus Academy has come with yet another OET Listening Live to help you with your listening. How are you all doing? In the previous live, we did part A, extract 1 and extract 2. In the previous lives, that's what we did. Today, we'll be doing part B, 6 questions. Okay, so 24, question number 24 to 30. 6 questions we will be doing tonight. And how do you do part B questions? You read the questions. You're given some time to read the questions. For each question, you're given almost 15 seconds to read the question and the option. So during that time, you'll underline the keywords. You'll understand the question very well, and you'll look for the synonym and paraphrasing in the audio, and you'll look for the answer in the audio, and you'll click on the answer. So it's important that you understand the gist of the audio, what they're actually trying to say in the audio. Sometimes the answer may not be in one particular sentence or 2 particular sentences. The answers might be the gist of the audio. So that is what you have to be careful about. And how is your practice going? Let me know in the comments. I'd love to know that. Are you all practicing really well? Yes. So today, before I begin, I wanted to tell you the meaning of 2 words. One is benign. The spelling is B-E-N-I-G-N. So benign, the word actually means of a disease not harmful in effect. Okay, that is not harmful. So in the options, one of the options has got this word, and you might get confused with what that is. So if you are a medical professional, you may already know that it is the disease that is not harmful. Another word is versatile. That means adaptable or flexible. Sometimes if you don't understand the meaning of words, some answers might go wrong. So that's why I'm giving you those words in advance, and so that you can actually learn the meaning of those words. Okay, so how this test is, how we're going to practice, I'm giving you a practical examination type question. So you will be given the audio. I'll play the audio here, and you'll be able to see the questions on the screen, and during that time you will write the answers on a piece of paper, and after that the questions will be displayed on the screen, and you'll have to copy down the questions onto a piece of paper so that you have the questions with you handy. And once you're done copying the questions, we'll discuss the answers with the help of audio script. So the answers will be discussed with the help of audio script. Okay? Yes. So, yes, Sophia Jitin, hi, good evening. I remember you from the previous lives. Yes, good evening. So, yes, tell me, how is your practice going? Are you able to practice? And is there anything that's bothering you while you're practicing? Is there any concerns or any suggestions? Let me know in the comments. So shall we begin? Okay, the audio will be played now, and you'll be able to see the questions on the screen. So write down the answers. It is part B. Okay, so just make sure the questions that you have, just make sure you are listening for the gist of it. Some questions are not direct, like you have to find the answer from what you're hearing. Okay, you cannot find the answer in one particular area. So it's important you listen to every bit of it. Okay, and also remember the meaning of these words. And then we'll be discussing the answers with the help of audio script. So be ready with a book and a pen.
Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting.
Anita. Megha,
For
Charles,
questions 25 to 30,
Sharon, and
choose the
Good
answer
evening,
A,
everyone.
B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. Now read the question.
Okay, afternoon guys. I'm sorry, it's been a bit of a short notice. We've been having a few incidents of IV gel-co infections. I know it's been a busy week and we've been in trouble with a lot of things, transition through to the electronic records from paper. But we need to know that documentation is our responsibility. We need to make sure that gel-cos, once you insert them, you need to document it. We need to check on the patient. We need to work as a team. The handover should be precise, and we need to check all these factors. We need to bring down these incidents. We can't allow these to happen. Last year we had a patient died of an infection, so we need to make sure that it doesn't happen again. So that's why I called you guys up. Let's start our day by not killing a patient. How about that?
Question 26. Now read the question.
During your stay, we will work to keep you as comfortable as possible. Unfortunately, it is unrealistic to feel zero pain after surgery. Our goal is to manage your pain at levels allowing you to participate in physical therapy and other activities. We have many tools to attack pain, starting with the peripheral nerve catheter, or PNC, inserted into your operative leg by the anesthesia team. The PNC delivers numbing medication to surround the nerve that supplies feeling to your hip or knee. We supplement the PNC with other medications as needed, either in pill or IV form. One big help in controlling your pain is to keep your new joint active by moving and working with therapy. Lying in bed too long can result in more pain as the joint grows stiff. In addition to pain medication, you will receive a 10-day supply of Lovenox.
Question 27. Now read the question.
Mr. Fernandez is a 52-year-old gentleman who was admitted to the ER last night. He lives with his wife Judy and was found down at home. They also noted he had lower extremity swelling for 5 days and was experiencing some shortness of breath and weakness. When they arrived to the emergency room, he was found to be in atrial fibrillation with a rapid ventricular rate between the 150s and 160s. After 2 boluses of diltiazem, he was started on a drip. He has 2 peripheral IVs, an 18 gauge in his left hand and an 18 gauge in his left. Both were started in the emergency room. Mr. Fernandez is a high fall risk because he fell at home. His bed alarm is on at all times and his call bell's within reach.
Mr. Fernandez, since you fell at home, you're considered a high fall risk, so we need to keep the bed alarm on at all times, okay?
Okay.
And if you need any when you get up, you need assistance, so make sure that you call when you're getting out of bed.
I will use this red button on this.
Okay, so we can count on you guys to call when you need help, right? I need to go get a report on my other patients, so I'll be back in about 20 minutes. But if you need anything, make sure you call, okay?
Okay, thank you. Sounds great.
You're welcome.
Question 28. Now read the question.
I've been a nurse for about 11 years now. I started off in cardiac, which I loved, but I was working nights and I wasn't in love with that. And then after that, the school where my kids go to school opened up, and so I was a school nurse for several years. And during that time, I just felt like I had a lot of kiddos coming to me with just a variety of issues that were more behavioral issues, such as they were maybe harming themselves in some way, or maybe having some really big anger issues that they did not really know how to cope with or deal with. And I would try to help them as best as I could and get them some community support. But I really felt like I did not have all of the answers that I personally felt like I needed, or I felt like I needed a little more training. So I ended up leaving the school and worked full-time.
Question 29. Now read the question.
It is true that athletes are specializing at a younger age than they did a decade or 2 decades ago. And that does create overuse problems with doing the same repetitive motions year-round, which is why we typically recommend for kids, hey, enjoy everything, be involved in everything, do a lot of different things. There will always be sports that one athlete will excel more at than another, but it's still healthy to be a multi-sport athlete and use different body parts and different mechanisms. And when you're growing and developing, that has a different impact on your body where you have open growth plates versus when you get older and those growth plates close. And if you're doing the same repetitive activity in a specific area with an open growth plate, you can have a problem there.
Question 30. Now read the question.
This is one of our mannequins, the SimMan Essential. He is capable of being a healthy patient. We can also program in variables on him that cause him to be unhealthy patient as well, because as we know, most of our patient population these days aren't your typical healthy patient. So when we bring the students into the room for the simulation, they are able to do an assessment of listening to heart and lungs on our mannequin. They can do a neurological evaluation of his eyes as well. Shortly thereafter, then, we go ahead and start the anesthetic procedure. So we start by giving him some oxygen by the mask. Obviously, he's still awake at this point in time. And then the students are expected to start the drug administration. And I am on a computer in a different room able to program the drugs that the students are giving. And then the mannequin responds to the drugs by either going to sleep or getting sleepy. So that the students then can carry on the procedure that has been outlined for them. What's neat about these mannequins, we can mask ventilate them, we can put special airway devices in like an endotracheal tube. If they don't happen to get the endotracheal tube in the right spot, he has a blue light that'll light up in his mouth to show them the patient is not getting enough oxygen. I'm on the control and I can make the heart rate and the blood pressure change parameters as well. So it's a learning experience for them so they can identify maybe they didn't put the endotracheal tube in the right place. He also has IV access, so we can do IV practice on him. We can give the drugs through the IV. That's typically how you do it in the anesthesia.
That is the end of Part B.
So, how was the audio? Were you able to answer all the questions? All the 6 questions? Or were the questions really difficult for you? Let me know in the comments, was it easy or difficult? And a lot of people are saying good evening to me, so happy to see you all. Manisha Sunil, Claudine Lewis, Annette Sato, Jisha Sharon, Deepa Bobin, Clarina Fernandez, Linu Thomas, Biban Nadi, Mega Charles, Little Tricky, yes. I get it. It was a bit tricky. Okay, so this time onwards, you will type in the answers first and then we'll discuss. All right, I need to see which option tricked you the most. All right, is it okay? Yes, we'll start with question number 1. Tricky. Yes, it was tricky. Sometimes you need to practice tricky materials as well. All the materials shouldn't be easy for you. You'll be able to see we'll be discussing the answers. But before that, you can write down the questions. I'll read the questions to you. Note down the questions. So you'll have questions with you while I'm discussing the answers. Okay? Yes. Amu Abhi. Monisha, hi. Hi, everyone. So, 25th question, write down 25th question. You hear a nurse manager speak to his Esther Praveen, really bit difficult. Yes, we'll discuss the answers. Now copy down the questions and after that we'll discuss the answers with the help of audio script. So you'll be able to see the audio script and you'll be able to answer it. You hear a nurse manager speak to his team. What needs to be focused on? Option A, effectively pacing the week ahead. Effectively pacing the week ahead. B, attending to the patient regularly. Attending to the patient regularly. Yeah, Esther, need to concentrate. Option C, ensuring the completion of procedures. 26th question. You hear a doctor discussing with a patient the complications of a surgical procedure. The risks associated with the procedure are benign. That means not harmful and can be corrected. B, uncommon and problem-free. C, varied but usually infrequent. You hear the next 27th question. You hear the head of a unit. You hear the head of a unit discussing patient details. Observation made on the patient is. Observation made on the patient is a satisfactory according to the results. B, encouraging for further treatment. Encouraging for further treatment. Option C, stable as per ongoing treatment. 28th question. You hear a nurse brief about behavioral nursing. You hear a nurse brief about behavioral nursing. What is the purpose of the extract? What is the purpose of the extract? A, to identify shortcomings in children. To share, option B, to share school nursing experience. C, to highlight a shortage of expertise. '29. You hear a scientist deliver a talk on physical activities for children. What does he advocate? Option A, repetitive activities for specific areas. B, minimize overuse of certain parts. Minimize overuse of certain parts. Next, must play in a variety of sports. Must play in a variety of sports. 30th question. You hear a talk by a nurse anesthetist. You hear a talk by a nurse anesthetist. How do mannequins respond to procedure? Thirtieth question is, you hear a talk by a nurse anesthetist. How do mannequins respond to procedure? A, by alerting the nurses if vitals fluctuate. B, by being versatile to the presenting process. C, by mimicking the changes in ill patients. So by this, I think you all copied down the questions. So shall we start discussing the answers? Shall we? Yes. So tell me, what is the answer of 25th question? 25th question is, you hear a nurse manager speak to his team. You hear a nurse manager speak to his team. So you have to say, what needs to be focused on? Is it A, effectively pacing the week ahead? Is it option B, attending to the patient regularly? Is it option C, ensuring the completion of procedures? What is it? What needs to be focused on? What needs to be focused on? So he's saying some needs. So the underlined keyword is need and focus. Pacing the week ahead, attending the patients regularly, ensuring the completion of procedures. You can use the elimination method. You can tell yourself why that part is not the answer. Why one part is the answer. So that you can eliminate the options that are not the answers by telling the reasons for it. Maybe they're not talking about it in the point, or they're contradicting the point. So tell me the answers. I'm waiting for answers. I'll see your answers first and then we'll discuss. Okay? Yes, so we'll start discussing the answer. So part B, in this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at the question 25. Now read the question. Okay, afternoon, guys. I'm sorry, it's been a bit of a short notice. We've been having a few incidents of IV 𝐎𝐄𝐬 infections. I know it's been a busy week and we have been in trouble with a lot of things transition through to the electronic records from paper. But we need option B. Sophia, Jadin, Jenny, Shaju are saying the answer is option B. Let's read and see. Option B is attending to the patient regularly. Attending to the patient regularly. So let's see, effectively pacing the week ahead. They're nowhere talking about effectively pacing the week ahead. Attending the patient regularly, let's see, but we need to know that documentation is our responsibility. Documentation, we need to make sure that, so there are certain things that we need to do. So they're talking about the needs. Documentation is one. Make sure that 𝐎𝐿CO is, once you insert them, you need to document it. So documentation, we need to check on the patient, and we need to work as a team, and the handover should be precise. Handover should be precise. We need to work as a team, and we need to check all these factors. We need to bring down these incidents, and we can't allow these to happen. Last year, we had a patient died die of an infection. So we need to make sure that it does not happen again. And so that's why I called you guys up, and let's start our day by not killing a patient. How about that? Mega Charles is saying C. Yes, option C. Ensuring the completion of procedures. Read the highlighted portion once again, Sophia, Jidin, and Jenny Shaju, and tell me if you actually understood it. Here, no way they're talking about effectively pacing the week ahead. How can we eliminate option B, attending to patient regularly? They're not talking about attending to patient regularly. They're just saying we need to check on the patient. No way they're talking about doing it regularly. So check on the patient regularly, attending on the patient regularly. That is not what they're saying. Okay? Shahar Banu is saying option C. First I select C, then I changed. Okay, why did you change? Why did you change your option? Because you thought it would be attending to the patient regularly, that part. But here they're talking about completion of procedures. Yes, I know it's tricky. You have to derive the meaning from it. Here they're talking about different procedures, right? Check, we need to work as a patient, handover should be precise, completion of the procedure, okay? So ensuring the completion of procedures, that is what they have to document it. So completion of procedures is what they're talking about. They told about death something. Yes, a patient died. So you thought it might be that they take care of that patient, okay? We had a patient die of an infection, so we need to make sure that it doesn't happen again. So you thought it would be attended, but they're saying the needs here. We need to know that documentation is our responsibility. We need to know that once you start inside them, you need to document it. We need to check. So the needs are mentioned here. So the need to focus is what they're talking about. Focus on these kind of things. Okay. Clear. Yes, very good. Very good. I'm so happy to see your messages and your comments when you're responding. It's actually really encouraging, and we feel like telling more and more things for you. Okay, coming up with new tricks, coming up with new strategies to do it, and explaining it in the better way so that you would understand it. So I totally appreciate your effort in interacting in this session. Okay, very good. Now, shall we move on to the next question? Question number 26. I'll read the question. You hear a doctor discussing with a patient the complications of a surgical procedure. The risks associated with the procedure are benign and can be corrected, uncommon and problem-free. Option C, varied but naturally infrequent. Usually infrequent. Let's see that. Question number 26. Answer this question. Let me know your answers in the comments. We'll see your answers first and then we'll discuss. So, 25th, the answer is option C, ensuring completion of procedures. Clear? Okay. Mega Charles is saying the answer is B. Let's see. B is uncommon and problem-free. Benign and can be corrected. Option A, varied but usually infrequent. Here, you know what? When you listen to the audio, you'd feel like all the three could be answers. Right? Did you guys feel that way? Because it was so tricky. Yes. Let's find out the answer from it. During your stay, we'll work to keep you as comfortable as possible. Unfortunately, it is unrealistic to feel zero pain after surgery. Sophia Jidin is saying yes. A. Tricky. This is very tricky. I totally agree with you. This question is tricky, but I was bringing up such questions so that you start thinking in different ways and you have exposure to all types of questions, whether it be tricky or easy or moderate difficulty, and all types of questions. You must be aware of the fact that you can get any type of question for your exam. Option A, Sophia has an answer option A. Mega Charles is saying option B. Yes, I would get when you say that all the options could be the answers, because even I felt the same when I first read it. So it is unrealistic. So uncommon and problem-free, benign and can be effective. That means not very harmful. It is not very harmful. So it is unrealistic to feel zero pain after surgery. Our goal is to manage your pain at levels allowing you to participate in physical therapy and other activities. So here they're saying there is a risk, okay? So uncommon, there is a risk. They're not talking about whether it is harmful or not. Whether this pain is harmful or not, you cannot find it. They're just saying it is unrealistic to feel zero pain after surgery. So unrealistic, harmful or not, they're not talking about that point here. So we can eliminate option A, benign and can be corrected. Okay, our goal is to manage your pain at levels allowing you to participate. So this pain is actually manageable. They're managing this pain. It's not they're correcting this pain. Are you getting my point? Nowhere they're mentioning harmful. Elimination method is what we should be using. Nowhere they're saying it is harmful or not harmful. Nowhere they're saying it can be corrected. They're here just talking about managing the pain, not completely corrected. Managing at levels allowing you to participate in physical therapy. So that means this pain is actually varying. That is why they have to manage it to a level. So if the pain stayed in one level, they could actually reduce it. But now, and the pain is actually increasing and decreasing and it is varying. That is why they have to bring it to the levels where allowing you to participate in physical therapy and other activities. We have many tools to attack pain, starting with peripheral nerve catheter or PNC inserted into your operative leg, anesthesia team. So the tools that they have. So option A is eliminated. Option B, uncommon and problem-free. Nowhere they're talking about it is uncommon or problem-free. Are you able to see that they're saying it's problem-free or uncommon? They're not telling. They're saying it is uncommon. It is unrealistic to feel zero pain after surgery. That means you can somewhere, it can have the meaning it is uncommon. Okay? Not common. Unrealistic. Okay? It is uncommon or unrealistic to feel zero pain. So somewhere it is similar. But are they talking about problem-free? That point, are you able to see that? No. The PNC delivers numbing medication to surround the nerve that supplies feeling to your hip or knee. We supplement the PNC with other medications as needed, either in as needed. Medications as needed. That means the pain changes. The pain is varying. That is why as needed. It might be needed at times it may not be needed. It might be needed at some levels. So some levels are there for this pain. This pain is varying. One big help in controlling your pain is to keep your new joint active by moving and working with therapy. Lying in bed too long can result in more pain as the joint grows stiff. In addition to pain medication, you will receive a 10-day supply of knots. So one big help in controlling your pain is to keep your joint active by moving and working. Okay, one big help is keeping it active. So how we can reduce the pain? Working with therapy. Lying in bed too long can result in more pain. So that means the pain is again varying. Okay? As the pain joint grows stiff, in addition to pain medication, you'll receive a 10-day supply Lovenox. So this pain is not frequently coming. It is coming if you're lying too long or you need the medications. When you need the medications, it is not frequent. Only when needed, the pill is given to you and the pain will be managed. Yeah, there is pain. Okay, so your answer is option C, varied but usually infrequent. Unrealistic to feel zero pain. Okay, feeling zero pain is unrealistic. That means there is pain. Okay, this is uncommon. So if it is common, there is pain. Right? If the symptom is common, think about it that way. If it is common, there is pain. It is common. It is uncommon. It is not common to feel pain. That is not what they're saying. Oh, I said the opposite one before that, I guess. Was it? It is a bit confusing. The word unrealistic to feel zero pain. That means there is pain. Yes, you're right. But here they say uncommon. When it is common, pain is common. When it is uncommon, pain is not common. Pain is not common. So that option can be eliminated. Yes, you're right. I think I made a mistake at first when I said it was twisted. Yes, it went the other way. So what I was trying to say was this point, unrealistic to feel zero pain. It is unrealistic. That is, pain is there. Uncommon. If it is common, pain is there. But when it comes to uncommon, no pain. Understood? So these are two opposite things and that doesn't make sense. So we are eliminating that option. I hope that's clear. So 𝐕𝐺𝐵HIN, is it clear now? Is that what you were trying to say? Amuwabi, option C is the answer. Yes. Mamta Malik, Mega Charles, yes. Option C is the answer. Is there any more clarification that you need? Yes, clear. Okay, yes. So shall we move on to the next question? Next question. These things are confusing because we took almost 5-6 minutes to actually explain one answer and we have to do it within 15 seconds and it's not easy. Moving right along, moving on to the next question. You hear the head of a unit discussing patient details. Observation made on the patient is satisfactory according to the results, encouraging for further treatment, and stable as per ongoing treatment. So when you read it, again, here also elimination method is what is going to work. Mr. Fernandez is a 52-year-old gentleman who was admitted to ER last night. Okay, it's clear. He lives with his wife, Judy, and was found down at home. They also know that he had lower extremity swelling for 5 days and was experiencing shortness of breath and weakness. So this patient was weak. When they arrived at the emergency room, he was found to be an artificial fibrillation with rapid ventricular rate between the 150s and the 160s. After 2 blues of deltaism, he was started on a drip, and he has 2 peripheral IVs and an 18 gauge in his left and an 18 gauge in his left. Both were started in the emergency room. Mr. Fernandez is a high fall risk because he fell at home. His bed alarm is on all times. And his call bells within reach. Ms. Fernandez, since you're still at home, you're considered at high fall risk, so we need to keep the bed alarm on all times, okay? Patient, okay, and if you need any assist when you get up, you need assistance, so make sure that you call when you're getting out of bed. Patient, I will use this red button on this, okay? Patient, so we can count on you guys to call when you need help, right? I need to go to report, so the one who is the staff is saying I need to go to report on my other patients, so I'll be back in about 20 minutes. But if you need anything, make sure you call, okay? Okay, thank you. Sounds great. So here, when you read the whole thing, what do you understand is that satisfactory according to the results, that is not what we're seeing. Again, I'm telling you this is confusing. It could have been a bit confusing. Just tell the answer that you wrote. Comment the answers that you wrote. And no way they're talking about encouraging for further treatment, so we can eliminate that option. Option B can be eliminated. Satisfactory according to the results, they're not talking about any results. So it should be option C, stable as per ongoing treatment. Okay? Yes. Moving on to the next one. Question number 28. You hear a nurse brief about, if you have an answer for that or if you have any questions, please drop them in the comments. You wrote C, 𝐴𝐶𝐓. Esther, your answer is right. It's option C. The answer is option C, stable as per the ongoing treatment, because they're not talking about according to the results, or they're not talking about any further treatment options. They're just talking about he's stable on as per ongoing treatment. Amua B, C. Okay, you're all really good at this. Sophia Juvin, C. Very good. Next question, 28. 𝐎𝐄𝐓 Charles, C. Very good, guys. Good job. Your answers are correct. Now read question number 28. You hear a nurse brief about behavioral nursing. This question must have been really easy. 28 was really easy. It was so direct. What is the purpose of the extract? A, to identify shortcomings in children. B, to share school nursing experience. C, to highlight a shortage of expertise. Okay, we'll read it. So 1, to identify shortcomings. What's the purpose of this extract? Shortcomings in children. To share school nursing experience. To highlight a shortage of expertise. I've been nurse for about 11 years now. I started off in cardiac, which I loved, but I was working nights and I wasn't in love with that. And then after that, the school where my kids go to opened up. And so I was a school nurse for several years. And during that time, I just felt like I had a lot of kiddos coming to me with just a variety of issues that were more behavioral issues, such as they were maybe harming themselves in some way, or maybe having some really big anger issues that they did not really know how to cope with or deal with. And I would try to help them as best as I could and get them some community support. But I really felt like I did not have all of the answers. I really felt like I did not have all of the answers that I personally felt like I needed, or I felt like I needed a little more training. So I ended up leaving the school and work full time. Share school nursing experience. What is the purpose? She's talking about it. Here is the problem. The key word is purpose of the extract. What was the purpose? She was saying about the nursing experience, school nursing experience, to say something. What was that? Amuabi, just tell me. She was explaining a lot of things. But what was the purpose of that extract? What was she trying to say? She was telling all these stories to come to the point. I really felt like I did not have all of the answers, that I personally felt like I needed, or I felt like I needed a little more training. So I ended up leaving the school work and work full time, school and work full time. So the answer is option C, to highlight a shortage of expertise. That's what she's trying to say. Throughout, she's mentioning those things. She said a lot of students, I worked in a school, a lot of students came to me, and the problem I found was that these students did not have, I was not able to provide them enough information because I didn't have an idea about those things. Okay? Many problems. Megha Charles, children, many problems children are facing. Children facing many problems. Did you write that option? No, to highlight the expertise, shortage of expertise. That's what you wrote. The shortcomings. What do you mean by children facing many problems? What were you trying to say there? Could you tell me? Okay. We'll move on to the next question. Next question is, Mega Charles, if you can clarify that part, it would be great. 𝐴𝐵, I hope you understood why the answer became option C. Okay, because she's trying, did you read the highlighted portion? I hope you read it and you understood it. Moving on to the next question. You hear a scientist deliver a talk on physical activities for children. This question is also very easy. The answer is very easy. Drop the answer in the comments. Tell me the answer in the comments. Repetitive activities for specific areas. What does he advocate? Repetitive activities for specific areas. Minimize overuse of certain parts. Must play in a variety of sports. So it is true that athletes are specializing at a younger age than they did a decade or 2 decades ago. And that does create overuse. Option A, repetitive activities. What does he advocate? Esther, the question is, what does he advocate? What does he say has to be done? So while I read it, you have to tell me, Esther has to tell me what will be the answer. Is it option A, B, or C? Okay, yes. Okay, all of you, you have to tell the answers once again after I read this for you. It is true that athletes are specializing at a younger age than they did a decade ago or 2 decades ago. And that does create overuse problems with doing the same repetitive motions year round. That does create overuse problems with doing the same repetitive motions year round, which is why we typically recommend, what does he advocate? We typically recommend for kids to, they enjoy everything, be involved in everything, do a lot of different things, lot of different things. There will be sports that one athlete will excel more than at another, but it's still healthy to be a multi-sport athlete. That's what he's recommending. And use different body parts. So throughout, he is recommending them to play different types of sports and use different body parts and different mechanisms. And when you're growing and developing, that has a different impact on your body, where you have open growth plates versus when you get older and those growth plates close. And if you're doing the same repetitive activity in a specific area with an open growth plate, you can have a problem there. So what is he recommending? What does he advocate? Yes, 𝐴𝐵, the answer is correct. Option C. He's advocating must play in variety of sports, not minimize overuse. No way he's saying, yes, he is talking about it, but that is not the main point. He's recommending. What is he recommending? Minimizing the use of, is it clear? Many different sports. Yes, option C is the answer. Mega Charles, very good. Many different sports. Yes, that is what they are saying. 𝐴𝐵, it's clear. Esther Praveen, tell me, is it clear? Now, okay, it is clear. Okay, so now you understood why the answer is like that. If it is not clear, you don't have to say it's clear. I'll explain it once again, okay? Okay, so repetitive activities for specific areas, definitely that is not the option. That is not what he's saying. Minimize overuse of sports. Yes, he is saying that as a minor point, but the main point he's recommending is to must play in a variety of sports. Very good, guys. Very good. Good job. Next question. How do mannequins respond to procedure? Option A, by alerting the nurses if vitals fluctuate. By being versatile. What is versatile? Adaptable or flexible to the presenting process. By mimicking the changes in ill patients. Okay, advise different sports. Yes, he advised different sports. So Fijidin, that is the answer. Yes, very good. How do the mannequins respond to the procedure? Mannequins respond to the procedure Do they alert if the vitals fluctuate? If the vitals fluctuate, are they responding? No. When you read it, you will not see the vitals fluctuate, they're responding. Versatile, they being adaptable to different procedure. Yes, we'll see them being adaptable by mimicking the changes in ill patients. They don't mimic any changes in the ill patients. We'll read. This is one of our mannequins, the Sim Man Essential. He's capable of being healthy patient. We can also program in variables on him that cause him to be unhealthy patient as well. So healthy patient and unhealthy patient. So we can program him that way. Read the highlighted portion. If you want, you can take a screenshot of this. Read the highlighted portion. I'm on a computer in a different room, able to program the drugs that the students are giving, and the mannequin responds to the drugs by either, going to sleep. So they're giving anesthesia drugs. So these mannequin response is versatile to the procedure, responds to the drugs by either, going to sleep or getting sleepy, so that the students, they can carry on the procedure that has been outlined for them. And in another part, they're saying if they don't happen to get the endotracheal tube in the right spot, he has a blue light that will light up in his mouth, as shown the patient is not getting enough oxygen. Here, they're responding not when the vitals are fluctuating. They're actually being versatile or flexible to the procedure. Is it clear? Is it clear, all of you? So tell me, what is the answer? What is the answer for this comment? I'm waiting for your answers. Yes, comment. Yes. So I'll read the remaining part. This is one of our mannequins, the Sim Man Essential. He's capable of being healthy patient. We can also program him in variables on him that cause him to be unhealthy patient as well. Because as we know, most of our patient population these days aren't your typical healthy patients. So when we bring, yes, Esther Praveen, the answer is option B. Yes. So we bring the students into the room for simulation. They are able to do an assessment of listening to heart and lungs on our mannequin. They can do a neurological evaluation of his eyes as well as shortly thereafter. Then we go ahead and start the anesthetic procedure. So we start by giving him some oxygen and by mask. Obviously, he's still awake at this point in time. And then the students are expected to start the drug administration, and I'm on a computer in a different room able to program the drugs that the students are giving. And then the mannequin responds to the drug by either, going to sleep or getting sleepy, so that the students then can carry on the procedure that has been outlined for them. What's neat? B. Mega Charles, Amua B, Esther, Praveen, all of you said option B. Very good. Okay, so I hope you wrote the answers correct, and I'll read this. Then the mannequin responds to the drugs by either, going to sleep or getting sleepy, so that the students then can carry on the procedure that has been outlined for them. What's neat about these mannequins? We can mass ventilate them. We can put special airway devices in, like endotracheal tube. If they don't happen to get the endotracheal tube in the right spot, he has a blue light that will light up in his mouth, as shown. The patient is not getting enough oxygen. I'm on the control, and I can take the heart rate, make the heart rate and blood pressure change parameters as well as. So it's learning experience for them, so they can identify maybe they did not put the endotracheal tube in the right place. He also has IV access, so we can do IV practice on him. We can give the drugs through the IV. That's typically how you do it in anesthesia. 5 out of 6. Very good. Question number 25th one. 25th one, the answer is C, ensuring completion of procedures. 25, this is question of Esther Praveen. I hope you can see this. This is question 25. That highlighted portion is the area where the answer is. The answer is C, option C. Option C, because they're talking about completion of the procedures, ensuring the completion of procedures. Look at the word need. They're telling need in different places, and that's how it is set. Okay, it's clear. Very good, very good. I'll show the answers once again. 25, option C. 26, option C. 27 option C, 28 option C, 29 option C, 30 option B. That is, except question number 30, all the answers are C, option C. Very good. Thank you so much, and a special thanks to all the students who participated actively. Megha, Charles, Sophia, Jitin, Esther, Praveen, Ammu, Abi, all of you. You were like actively participating and interacting. Thank you so much, and thanks so much to all the other students who were watching us. Thank you so much. We totally appreciate your effort. And we'll meet again in the next live on Saturday. Saturday at 8 p.m. We'll come with another OET listening prowess. Until then, bye-bye.